Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bringing another really fascinating guest for you involved in creating a better tomorrow. Today, we have the honor of being joined by Dr. Päivi Sillanaukee, a special envoy for Health and Wellbeing at the Ministry of Social Affairs and Health of Finland, who has over 2 decades of experience at the highest civil servant administrative positions, both from government, including roles as Director General at the Ministry of Social Affairs and Health, as Ambassador for Health and Wellbeing at the Ministry of Foreign Affairs, as well as various additional roles in the public sector at the municipality and special healthcare district levels. She's actively participated in global health, has chaired and facilitated global multisectoral, multi-partner health security collaborations, facilitating capacity building at the country level, has served as vice chair and member of the WHO Executive Board, as executive president for the WHO Europe Regional Committee, member of Women in Global Health, advocating for gender equity in health, as well as a member of Global Pulse Finland's Health Sector Advisory Board. She also served as a co-chair of the Alliance for Health Security Cooperation and member of the steering group for the Global Health Security Agenda, and currently also many roles here, member of the Board of Directors of Healthcare Information Management System Society, and member of the Inaugural Board of the Digital Health and AI Research Collaborative. Dr. Sillanaukee graduated with a medical degree, PhD, and MBA from the University of Tampere, specializing in public health administration, also an honorary doctorate from the University of Helsinki, Faculty of Medicine. A lot of really interesting topics to get into today. We're honored to have her with us. Dr. Päivi Sillanaukee, thank you so much for taking time to come on the show.
Of course. Thank you for
Good.
asking me to join this discussion.
Well, it's wonderful having you. A lot to get into, a lot of really important themes that we touch on in our show. Would love to start off sort of at the early stage of things. I noticed, very early on, looking at both your dissertation, which focused on various, accounting costs, patient care and hospital systems, various publications you did in terms of specialized nursing care, substance abuse, many themes at the intersection of healthcare and economics. Talk a little bit about how you got started in sort of this very important path at the intersection of these two themes.
Thank you. Actually, it was not so much planned before as things happen sometimes, but I think that was really a right path for me then, because I really like to look things from the big perspective and an overview, and then I really like to be in and running then changes in organizations and transformations. And my interest has been there. And I was supposed to actually begin at the Tampere University Hospital then, one research project regarding then genomic research, actually then 1990s, was involved into that. And messenger RNA, for example, was already then in the focus there. But then they put me then to test the cost accounting system in the laboratory, because that was then one of those 2 big hospitals where they were testing that. national cost accounting system. And I thought that it was quite of the old way of thinking, that it was really challenging because when working in a laboratory, there are hundreds of tests, and then all the costs and information regarding then those tests should have been put first into that system before you could get anything out of that. And I had somehow played with Excel and its macros before and thought that it's quite simple to put that in that Excel and really get then, for example, only one test and then the average of the other tests then there. So it would be, and then presented that idea, and suddenly I was in the national board of the laboratory test accounting development, and then Nordic level at the same thing, and then I was struggling that what would be then my dissertation theme, and suddenly then focused that okay, I have done already so much then regarding this cost accounting here, so why don't I take this as my topic there. Of course, I have also publication then regarding the one really interesting regarding then the genomic research, but that was then after. But then how I got into the administrational pathway then after that cost accounting dissertation, it was because it was then a collaboration between the medical faculty in the Tampere University, but then also it was like collaboration between the Helsinki University Business School, of course, because it was like cross-sectoral. And it was really interesting then because I faced then the differences in those different faculties. So it gave me again insight into different sectors and how different then the thinking is in different faculties and in different sectors. And that has then followed, and it already then gave me then understanding that it's really important to have a multi-partner, multi-sectoral collaboration when you are then running changes and this digital transformation we have been facing all over then globally. So when I had done that cost accounting projects in that hospital and some health centers also, I noticed that accounting costs actually doesn't change anything. So you have to focus more on the change management, and then the continuous quality improvement was really a big theme also under healthcare. And there was Harvard area was the first in US who tested then that would that Deming theory, which was used then in industrial field, so would that apply also to health sector? And they found out that yes, it would apply, and then that became then a movement, global movement then in health sector, and there were British Medical Journal and then UK and in Europe and US then collaborating then there. That is the way we should then develop and have a continuous development in our organizations in healthcare. And then I was more focusing on that, and during that time began then to develop and have development projects regarding patient pathways, where you actually need then this kind of multi-partner, multi-sectoral collaboration. So it was that way, and then I was had my first top level administrational position also. That was first pilot in Finland, where we merged or integrated the primary healthcare to the secondary healthcare. That was in the beginning of 2000 then.
Right.
At the same time also went to municipality politics, which then gave me insight to the interface of political processes and then also to civil servant ways of preparing then decision making processes.
Yeah, it's I noticed at the beginning of this is in 2001, you start taking on these sort of positions of increasing responsibility at the I guess what's called the specialized healthcare district level, which and I'd like you to sort of walk us through a little bit of how sort of social and health services are deployed in Finland, for those that are watching and listening to the show might not be that familiar with. But then, as you were saying, you then run for mayor of Tampere, which you become the mayor. Talk a little bit, because I think this is important, because you have the healthcare role, but then as mayor, you also have, the other part of that, the social services side. So say a couple words about sort of, this must have been a series of unique experiences for you. Let's put it that way.
Yes, it actually was, and that was then the basics for my ministry career then.
Yeah.
So as I mentioned, I was working then specializing in the Tampere University Hospital for neurology and rehabilitation, and at the same time I was working also there for administration department then, because I was part of then and quite much of responsible of then educating the health professionals for cost accounting, but also this continuous quality improvement, which actually is called now lean management. And then I was appointed to the director of this Mäntä region district, where we then integrated then the primary healthcare of 2 municipalities, then 2 specialized healthcare districts. And we had at that time, in Finland, the primary healthcare and social services were, the responsibility were under the municipalities. And then the specialized healthcare, hospital care, was then in 20 specialized hospital districts, and each municipality had to then be part of that one of those 20 specialized healthcare districts to be able to then deliver specialized healthcare services to their people. We have in our constitution here in Finland right for everyone to get those services, health services and social support they need. So it's kind of a universal coverage system here. And we have a taxation-based society, a welfare society, where we collect quite high taxes, as in all of these Nordic countries. But then we provide education, also university education is kind of free for us then, and also those social and health services and then social support also. So that's why the municipalities and government are involved so much into providing then the health services and social services and support also. And while I was then the director of that region there, I also participated the Tampere, which is one of the biggest cities in Finland. I was participating in the municipality politics there, and I was then chairing the social and health service committee there, and because I had that kind of experience there, and there became then the deputy mayor position available. So then the party I was representing there then suggested for that, should I apply also, that I should apply also that. And I haven't been in politics before that. But it was like, okay, again, it is like a possibility then to take a responsibility role where I also have then more power to try to make the changes I saw then that is needed there. So you actually need and it helps if you have then a political some kind of political involvement to get this kind of deputy mayor and mayor positions. And
Right.
that deputy mayor was then responsible on social and health services.
Right.
I was then the first woman and the first physician who got that position there as a mayor. And it was then at that time more kind of the civil servant kind of role, although there was also that political background for that, but it was more that I was then responsible of organizing the social and health services then to those citizens in living in Tampere region, and municipalities have then possibility to provide the services and organize the services so that most of them are then provided by public providers which work for municipality. So also physicians and nurses, they are not private practitioners, but work for and get salaries from municipality. But then there are also private providers and some NGOs also. So this whole puzzle was under me, and how to organize that also then. And having that position, then there became then open also the Director General position at the Ministry of Social Affairs and Health. And we were then in the middle of national social and health service reform.
Okay.
It actually took 5 governments to be able to get that reform through. And now we are implementing that for the second year. And the idea was already then that we need more integration of primary and secondary services, but also then more integration into social and health services, because Finland is aging second fastest in the world after Japan. So there is really need to be able to integrate more the social services and also then primary and primary and secondary care. But at that time, it was then the beginning of that. That was then 2008. The previous government had then begun that discussion about the reform. These reforms are politically really sensitive, as I think that you also know that in the US, but in any country it is, and it takes time to get them through. But then because I had already that background, integrating primary and secondary healthcare, having then had responsibility then at the big municipality level of these services, and having my educational background also, dissertation which was then about also the understanding the administration and economical issues, organizational development. So I was then appointed also Director General responsible on social and health services. And since then, 2008, I have been working for different governments. But as a civil servant role, and not anymore as a politician.
Right. Yeah, it was interesting because I pulled down some interviews that you gave from that period, and again, you had to answer questions on lots of things, from paying for flu vaccines to the funding of the Institute of Health and Welfare, and then they're also asking you questions about universal basic income and child tax benefits and this, that, and the other thing. So again, you're juggling these dual responsibilities as Director General, ultimately both social and health. Come 2019, you hold what is called the high-level conference on the economy of well-being in Helsinki. You lead this initiative as well as on some of the panels. Sort of the economy of well-being is defined in this case at this conference as this two-way relationship between well-being and the economy. Obviously, something that you build up a lot of specialty in. Talk about what that means a little bit, because there's several components of that in terms of social mobility, well-being outcomes, inequality, eliminating inequalities. And then from there, we'll get into a little bit of what you were discussing on sort of the infectious disease front. But introduce us to the concept of the economy of well-being.
Glad to do that. A little bit background for that. So we have in Europe, EU, there is each half a year the EU presidency or chairing then the meetings with between member states that rotates. The presidency rotates, and Finland had then 2019. Then the end of the year part, half a year, then EU presidency. And the previous presidency we had, if I remember right, somewhere there 2006 or 9 or that time. And already then we introduced, we had been active both at the WHO, but also then the EU level, and we then earlier in 2000 we introduced health in all policies policy, which means that when we think about health, we also have to think themes beyond health and health services. So because the prevention needs a lot of other things, education, it means also then nutrition and possibilities for people to exercise and choose healthy lifestyles, and also then brain health and issues like that. But then it developed so that because we in Nordic countries have this welfare society, there is already showcases here in Nordic Nordic countries that this kind of policy where you actually try to support also from government side, then people's possibility then to get their whole potential into use in our societies. So the idea that we should have that kind of policies where we think that people would be able to have education, they would be able to have social and health services, that we can support them, their decent kind of living conditions, also taking into care that during our educational pathway there would be information for people about then gender equality things, because it's important that all the potential, not only half of the potential of the society is in use, but all the potential. There has to be like daycare also to be able to make it possible for women also to get into work. We had also school meals, like warm school meals since 1940 to be, and that also supports then possibility that there is ability for women also to attend to working life. So kind of a comprehensive thinking of what healthy life would look like, that and that also other ministries and sectors should give have responsibility and understand in what way they have an impact on people to be healthy, because when they are healthy, they go to work, they can work there, they can work longer, and in that way also contribute to national economy. And as I mentioned, also the cultural things is important, that there are people can then go and have also like music, art, theaters. They are important when we grow up as human beings. It's part of being human being that you have also those dimensions into your life. So this is kind of the economic well-being, thinking about that that if we then support then the health from the broader perspective, that our societies are health, our environments are health, that has a positive impact on national economy. And we can really prove that here in Nordic countries, because Finland was quite poor country, agricultural country, and then after Second World War. And by taking this kind of policy, different parties agreed then that, okay, we will pay, then have this kind of society and build this kind of society here. And we were poor country then, so they invested into these things. And now we are one of the most innovative countries and have quite high national economy also do quite well here, as other Nordic countries also. So that is the thinking behind the economy of well-being. So get also other sectors, not only focus on social and health services and how we provide them for our people, but how we actually enhance public health, and in that way make the national economy to grow. And OECD took this really happily also. They saw it that there is really a big potential then to highlight this kind of thinking. EU took it. We got then a resolution, which was then agreement of the member states how we are going to build this and implement this kind of thinking in EU, and also WHO has taken this thing. So that is kind of the idea, how to keep people healthier so that they wouldn't need social and health services so much.
Mm-hmm. And continuing along that theme, at the high level conference, one of the plenary session that you participate in, sustainable inclusive economy in the framework of sustainable development goals, you give a talk on health security. It was entitled Health Security Global Challenge. And here, I mentioned in the bio that of the show that, you are also involved in the global health security agenda and sort of this vision for keeping the world safe and secure from infectious diseases. Around this time, we had just come through Ebola and Zika. COVID hadn't happened yet, but nonetheless, making important points during this talk about the important multisectoral work that needs to happen to prevent the next one, which we were in the middle of at the time. Say a few words about your time with the Global Health Security Agenda and a little bit of this, because obviously enhancing public health, keeping infectious diseases away, very important part of that.
Thank you for taking that, because it's really relevant now, and it was a US initiative then that came 2013, 2014 then, and the idea again was that we have to also better prepare from global perspective to these infectious diseases, and it's not enough what WHO is doing alone, because we need animal health more into the picture, but then also food security, that is really important also, and environmental issues also. And then there was also biosafety and biosecurity, because there is also intentional use of these, can be behind these infectious diseases, but then the response is kind of the same. Is it the natural or intentional use? Intentional then the first kind of the where the infectious disease then comes and what's the mechanism behind that.
Right.
And that was really sensitive issue actually for many countries, but also at the WHO level then to talk about biosecurity and biosafety, because then you are touching the issues that actually are on the Ministry of Defense table also. Many countries, Ministries of Defense and Ministry for Foreign Affairs are taking then responsibility of these issues. And because we already had in Finland then had that health in all policies talk, and there is really low threshold in Finland then for multisectoral collaboration, and many ministries were working together, and the idea of prevention has been a very long time in Finland's focus regarding then global policies and health policies. So it was easier for us then to have that. And there were then actually United States White House took then contact into us then and asked that should we be interested, could we be, and would we be interested in taking part of this? And there were already some other countries on board. But then again, I may mention that it was quite sensitive for WHO. And but during that work, when we worked, the organizations tend to kind of defend their own position in this global architecture. So we had like WHO for the human health, and then there were like other organizations for animal health, and then there was FAO, which was for food security, and so on. We want and then other forums where then the Ministry of Defense then talked about the intentional use and bioweapons and so on. And during that work, we took all these partners together, and it wasn't easy in the beginning. And also, it was also at the US level. This facilitated also the collaboration between different ministries at the US level also, but that was also the other in other countries. And I remember that in really many countries, these kind of meetings we had was the first time when the different sectors actually sat around the table. But through that work then, if we today talk at the WHO tables then about health security and biosecurity and biosafety, it's really natural. It's like everyday bread. So, but it took that work that we really got to that one health approach, that we then after that have had antimicrobial resistance, a global structure for that, because that is also part of this. It needs also collaboration between different organizations. And now there is also a One Health structure where WHO, then Environmental Health Organization, FAO, and then the Animal Health Organization, their Director General systematically sit together and try to plan this and see this prevention and response discussions, have them together. So I think that we are much more prepared now than if we would have been without this global health security agenda work. It is now much more involved into the post-COVID discussions and then the financial mechanisms for how to then have the capacity building going on at different countries for health security.
Yeah. I'm glad you brought up not just One Health there, but also antimicrobial resistance, which has been unfortunately a very popular topic for us, and in a world where we're not developing as many antibiotics as we should be, and so forth. Again, it's good to see that it's on the agenda, and I'm glad you brought that up. Around the same time in 2019 that you host the high-level conference, there's also you also host the high-level forum on the silver economy per the UN Decade of Healthy Aging. Again, you participate in a panel, The New Silver Future. I think at the time Christine Lagarde was there as managing director of the IMF, sort of given the global demographic report of everything going on. And you were just mentioning before how Finland, has some demographic issues like many countries in terms of falling birth rates and so forth. Talk a little bit about the concept of the silver future per the Finland perspective. And then, I know you've been very active. There's sort of these two themes that we've touched on the show. On one hand, sort of age tech, on the other, sort of longevity biosciences. Seems like Finland's doing a lot on the age tech front from the perspective of health records, from the perspective of the concept of aging in place and health tech for senior care at home. Walk us through a little bit of your vision there for the silver part of the well-being economy.
Thank you. Yes, this is. There have been too much talk about our seniors then to be, and this aging being a burden for our societies. And we know that this is actually a really big success that we have seniors, and then the average age mortality age then it's getting up all the time in many countries. Although we now have this non-communicable diseases which seems to change this success story, but we have there is after retirement in many countries there are still decades people are active parts of society, and that was what we wanted to highlight, that we have then and we want to keep these people active. We want them to feel that they are part of our societies, and they will and then they can have an active life, because in that way they also are having impact into our economy, although not working anymore in their workplaces, but they can have an other kind of impact into our economy, and then because there is a lot of know-how also after retirement in many people, and then if we keep them active and healthy, then there are more quality and healthy years for them, and that then diminishes the burden for societies in regards of the health services needed or home care and things like that. And that was the idea then, that we have to have a broader perspective to aging there, that what are the things we have to do, and how do we have to change our societies also when there are more elderly people and seniors in our societies. So having also that economical impact there, and the role that we really want them to be part of active part of our societies. And I really loved then that ability to have again that economy and health at the same stage, then talking then about how we have to change our ways in societies, and what would be then the way to get this silver economy, as said, that how they could have more impact also to our economies, and live a full life also for a personal point of view.
Excellent. So
but then about the technology, you asked me about then
yes.
the technology. Okay, if I go into that, or would you like to then ask more about that?
Yeah, if you could take us, I mean, you can go into technology for aging in place, but in general, we'll get to artificial intelligence and digital health and some of the things you're doing with the related organizations. Yeah. But go in any direction you want with it, please.
Yeah. So one thing how this also has an impact in our economy is that there is a lot that the technological development, or then also insurance companies and so on, what kind of new products they could have then to support these people then their lives and quality life in our societies. So in that way, Finland has been ranked one of the top countries regarding digital societies and economies. So we have digital infrastructure, having had it long time here in Finland, and I would say that everyone has a mobile phone and can use then digital tools also, and as I have here Oraring also, so people love to have devices also and follow their own health here. So there is capabilities in our health professionals, but also then children, adults, also seniors to use these digital tools. So we have been developing in and also taking into account that our government and society is then responsible of using the tax money very effective way, and also providing then the health services most effective way. Then we have only 5.6 million people living here. The country is quite big, so there are remote areas also where old people are living. So we have been for years then developing digital tools so that we could give remote access then to our services, also rehabilitation and contacts for people. Digital rehabilitation is also one part. Then different kind of devices you can have at home, which support then living at home as long as possible. So this has been, but then also for your near ones and the family members, what kind of tools they would need to be able to contact and follow up your living at their home, and then devices to make sure that people take their medicine in the right time, and if there are possibility to see that someone has fallen at their home and need help. So there are different kind of devices also for that being developed. And we are now trying to facilitate. Now I'm responsible on so-called health and well-being sector growth and renewing RDI program, which is a government program having 5 ministries included here and private sector also included into that, so that we could now enhance then the ecosystems around our well-being districts, which are now responsible for social and health and rescue services, so that there would be really lively collaboration, public-private collaboration and academic collaboration, so that we could then develop then in this society where we have long-term data registers for people's health, but also socioeconomic information, use that data, because we have legislation framework also in Finland, one of the first, which makes it possible to use this data safely, respecting the privacy also for secondary purposes. So to be able to develop then and have lively development, co-innovation and co-development, that we could digitize then our health sector and support living at home. So this is then really something we are leading globally then, to be an ecosystem where you can develop this kind of tools and also AI. And we have opened our ecosystems for foreign researchers and foreign companies also, and welcome them here to innovate with us, because our people trust, and they have been able to see that it's safe to have this data also into the research and development use. We can keep their privacy there, but then also we have shown and showcases how we can be able to provide then tools for people to support their everyday life and make it easier their everyday life. So this is then the environment where and have also good collaboration with US, which is actually our largest market, import market, but collaboration market also with our health tech services and products, for example.
Yeah, it's I mentioned again in the intro to the show, your involvement in organizations like HIMSS and I-DAIR. I didn't mention you're also a board member of Health AI, and we just had Ricardo on a couple of weeks ago. Well, I guess while we're on this AI topic, concerns. I mean, I know, sort of health AI is all about, finding the appropriate balance for AI. And I know, obviously AI is doing great things in terms of diagnosis and the discovery of new drugs and everything, but obviously some concerns you might have. Any sort of top line items while we're on the AI topic and health tech while we're there, and then we'll scoot off to other topics.
Yeah, of course, AI is a great help for us. If we think we have pilot studies now going on where there is an ambient dictating for ambient use of AI, so that from the discussion of health professional patient, for example, it takes then a summary which physician can then check, or nurse can then check that was the right one, or then do the changes needed there. But then on the other hand, when we have AI helping people in social media, we have been seeing that the algorithms can be also really toxic, and we have to take that into account also, that how what kind of impact it has then for people's like conversations and collaboration. If we then, because it's so important that we also meet each other in person. You seldom say people things when you meet them in person, or in the same way that you put the things in and your sentences in social media. And there you have then that is one big threat, that if we more and more go into our bubbles, it's not a good thing for a society or anyone. And for that we can then find out the ways that how we can keep then AI serving us, and not so that we serve AI. Then we need to take especially care of how the biological information, I mean, then what you get then for vitals and other things when you go through the health services and are there in the health system, and then also then your health information there, which is in patient records, for example. This is the most sensitive data we ever have, but this is also this is actually the treasure for AI, because this kind of like behavioral data and biological and health data would then give a possibility also to develop that kind of tools that really help to develop tools that help us people and support our lives. So we have to find this balance. And we also noticed that during then the COVID time that we need to get the data flow across borders. It is really needed to be able to get a snapshot always at where we are, and to be able to prepare properly. And therefore we need this legislation discussions at the national level. As I mentioned, we have had that also in Finland, and we have quite good legislation already here, but it doesn't help us if we do not have the legislation or regulation which are compatible at the regional level, like EU level, and also global level. So we have to have all these discussions together. So global, regional, and national level discussions. And therefore, I'm involved in all these level, and Finland is involved in all these level discussions, because we have showcases and we have possibility to test also things here. And I think that this is so important that we have organization like Health AI, which can then bridge those organizations like UN organizations, WIPO, ITU, WHO, who are doing and preparing the normative things then for this. But they are not the organizations who can support the implementation at the national level or regional level. But Health AI could be that. And I don't know any other organization which has nowadays that kind of credibility that it already is in and has agreements with WHO, has agreements with this WHO, ITU, WIPO collaboration is under that, responsible on co-chairing the regulation part of that. And therefore, it's also important that at the EU level. By the way, our commissioner, there will be commissioners in the EU Commission from each country, and our commissioner will be responsible on regulation and also innovation things. We are really, really pleased and great, and thankful for that she got that powerful position there. But again, we can then help then by showcasing at the EU level and support this regulation preparations. But also US is now more involved into these discussions from the health ministry side, but also from other ministries side, so that we could then have this not UN organization, but also then countries more on board beyond EU then to have a discussion. Because if we do not have these regulations compatible, if we do not have global standards, we will not have benefit from all the tools that companies are developing in different parts of the world. Mm-hmm. And that would be a great thing if we could then benefit from those tools that are developed and taken into account at the same time that the technology is developing so fast that it would be good to be able to have those into use as soon as possible when they have been developed.
Mm-hmm. Mm-hmm. Excellent. So, I mean, we're spending a lot of time on the health tech front. Would love to bring one other theme in now, and this sort of corresponds because in August 2020, you assumed the role at the Ministry of Foreign Affairs as Ambassador for Health and Wellbeing, and there's a very interesting article that you write. This is a couple of months later, entitled "How Does Finland's Healthcare System Contribute to the Nation's Happiness?" And you bring, in addition to health and to the economy connection, this principle of happiness. And it was interesting to find out that in the World Happiness Report in 2024, that Finland was rated as the happiest country in the world, probably partially due to your work on this front. But say a couple of words about what healthcare happiness means. And a little bit, if you could just introduce us to why Finland created the role of an ambassador for health and well-being.
Yes, that was again showcase how innovative Finland is and have courage then to do something that the other countries haven't yet done. And there have been global health ambassadors in some countries, but they have been more responsible on global health issues, global policy level issues, not so much on innovation, how to scale up innovations, how to facilitate then also the exports of developed tools, but also then collaboration between different countries and companies so that they can come into our country and use our ecosystems for developing then the new solutions. So that was then the idea that health and well-being sector is a sector where governments play a big role, because we define then the environment, business environment. But that is also, if we think about energy sector, it's more and more governments who do the regulation for and in that how define the business environments. Not only from negative side, like people quite often think that regulations, don't need them, we should be free of them. But they partly they secure then, as I mentioned, then the privacy of us. But then they also ensures that the business environments are compatible, so that if the standards are are the same at the national and regional and global level, so we can then benefit of the innovations also more broadly. And that was kind of the basis then for this regulation thing. But then the happiness thing, I think that we come back to what I mentioned, that what was the idea of a welfare society, that if we try to then support people to get their whole potential, live their whole potential in their lives, so they are more willing to contribute to our societies also. And I think that people feel quite safe in Finland, that we can educate ourselves. We are a market economy. We can earn if we work hard. But then on the other side, then and on the other hand, then if I get sick, cancer, mental health problems, unemployment, then there is society which supports you and tries to get you back on track again. And that is kind of, I think that it's a basis for our happiness then, that there is not so much worry about that if something bad happens, that I'm being alone there. I think that is then one, but then having that ambassador role, then in that field, then was the idea that I would then be a high-level civil servant, having the credibility of understanding this theme, but also then having global network. So I could then easily talk to other countries, bridge other countries to collaborate with Finland, then coordinate then the different players in our country to be able to better collaborate and develop them and innovate new things, scale them up, and then also have private sector companies, invite them to invest more also in Finland in that way. So that position was for that. And actually, I'm now back to the Ministry of Social Affairs and Health, but continue that work from the Ministry of Social Affairs and Health, and Ministry of Foreign Affairs is part of this also. So the idea is that we also try to make Ministry of Social Affairs and Health more involved into our trade policy and in our R&D policy, and understand that this sector is really important when we think then the future market, future growth, because it has been estimated that this sector will grow during the next 10 years. The annual growth is expected to be 5.5%. This is really big growth. So there is a big opportunity then also for companies to then develop tools, get them into to use, and then it's important that you find then places where you can do that. You need and you find collaborators to do this, and that's why I travel, for example, a lot and meet ministry people, but meet also private sector companies, meet then also big, if I think US, then there are mayor, Kaiser Permanente, players like that, with which we can talk then and try to find out if there are possibilities for collaboration that would then benefit both countries. So for a civil servant, I'm kind of marketing our country, but at the same time trying to have an influence on how the environment, global environment, regional environment would look like, to be an ideal from the perspective of people and from the perspective of societies, but also from companies.
I've seen you in the Singapore press where they're reporting on the robotics and the AI for the aging population. You were in this Korean publication about the simulation hospital that you have in Helsinki, where there's no patients, just a lot of training of virtual patients and doctors. Really, no, it's really exciting stuff in the special envoy role. What should we be on the lookout for as we get near the end now of 2024, heading into 2025? Obviously, you've taken us through an amazing journey, arc of your career. What's coming up next? Conferences, other initiatives that are public facing that you can tell us about. Anything else that I missed while we have you today, please?
Thank you. So my traveling will continue. So there will be a lot of discussions with different countries. Then also I just came from Basel, where we have Roche and Novartis headquarters, for example. I also visited Canada, and their health Infoway is then responsible of the digitization of the whole Canada health sector. So we decided to then discuss further on the collaboration possibilities. Of course, I'm then next spring coming to visit then Mayo Clinic, and we'll have also then with the innovation hub then discussion that what kind of collaboration there could be for to able to develop then our innovation hubs even better, to do the innovation and do then the exchange and things like that. Of course, there will be then seminars regarding then both aging, but then the health tech. I'm really enthusiastic on how the health data would be able to use. How would Finland could offer then a possibility, an opportunity for companies to kind of try to develop then the future clinical trials, for example, because if I take that into account, we already have diagnostic tools, and we already have data available to be able to choose better patients who would participate in clinical trials. In the first phase in clinical trials, we usually take only safety. We look only safety, but we could already look there that what would be then who would be then the patients who could then benefit from that, and who would have then adverse effects and not so much benefiting it. So we could choose already better than people into that way. We can digitize then the clinical trials in a new way. So that would be one example. I think that we should much more think now about that we have quite traditional processes which are now regulated quite strictly. We should now think more about that. What would they look like if we could already use the modern technology and know how would the ideal processes look like? So I'm really interested in working on that, changing the way we now do things, and using then the technologies and understanding better, so that also the trials would be more personalized than before, but also the care would be more personalized. And then the shift from hospital care to primary care and also prevention, that is something I'm really much focused on. Also a collaboration between different countries who could collaborate with us then, and then taking then pilots, how we can use the new digital tools better, doing then the change from hospital care to prevention and more accurate care. And here we come back to the economy. We have to change also the way how we do and follow our budgets. In Ministry of Finance, they are so much stuck into your annual base following up of budgets. And now when we are going through the major reforms technologically, but also in our health systems, we should take which is quite often the way the private big companies take. So they have a long-term planning there and strategy how they do the transform. If we only stuck on annual follow-up, we are doing the savings from the wrong things. We are making our health systems more focused on the care, because that we have to anyhow give, and we are not using the opportunity for how we do the shift. Therefore, the incentives, we have to understand much better the incentives, what are needed from the financial side, but also from the those who finance our systems, that what kind of measures they should put to our health systems. Much more outcome-based measures. We should put our health systems measurements like we want you in 3 next years get the care levels of chronic diseases 30% better than they now are, and things like that. That would change then the way how they actually do. We are too much still using the same ways of following our systems to work than we used to do. But now when we have the data there available, we would have transparency better there. We could actually implement the policies we have been discussed at the WHO level, for example, for decades, to have public health better in our countries, better public health and focus on prevention, which comes back to the multisectoral collaboration.
Yeah, it's I love all of these themes, especially the topic of prevention, which I think most people believe that's the major answer to how we're going to keep quality high and costs from skyrocketing. And I also is very intriguing that you're talking about pharmacogenomics and toxicogenomics and digitalization, all that, and that's in essence where we started our conversation a few decades ago. So very exciting work. I just hope you're despite your extensive travel schedule, you keep your well-being and your happiness at the same time. But really an exciting journey you've been on, and I really appreciate you sharing it with us, and wishing really you and the team at the ministry the best with all of this as you continue to push forward this innovation to create better public health in Finland and spread the message beyond, obviously, Finland's borders. So a very exciting work. Again, for everybody that's going to be listening to this particular episode of our show across the podcast networks, or who are watching on our YouTube channel, again, you've been spending time with Dr. Päivi Sillanaukee, a special envoy for health and well-being at the Ministry of Social Affairs and Health of Finland. Päivi, I really want to thank you again for taking the time out of your schedule to talk to us for a little while today. Thank you for everything you do for global public health. And as we like to say on our show here, thanks for helping to create a better tomorrow for so many people via what you do. Really an awesome story.
Thank you. We are stronger together.
Great having you. Great message.